Hello, I am Dr. Geeta Chadha, a senior consultant at Apollo Cradle Royale and Indraprastha Apollo Hospital. We are going to be discussing what are fibroids and what are the symptoms of fibroids. Fibroids are benign tumors which occur in the uterus. They can also occur outside, but because I'm in gynecology and this is a gynac topic, I'm going to be restricting to fibroids in the uterus. Now, fibroids are benign tumors, but having said so, very rarely they do turn malignant in less than 1% of the cases. What can fibroids cause? Well, a lot of times fibroids are asymptomatic, means they do not cause any problem, they do not cause any symptom, and a lady may completely miss them because she feels absolutely fine, and it's only during a routine ultrasound done for some other indication are the fibroids discovered. On the other hand, a fibroid which is growing inside the uterine cavity or submucosal fibroid, right from the time when it is very small, may start creating a lot of problems in the form of heavy menstrual bleeding, abnormal uterine bleeding, or spotting in between. When such a woman has abnormal uterine bleeding, heavy menstrual blood loss, she goes for an early ultrasound whereby it diagnoses a submucosal fibroid or whatever size. Treatment of such a case is very simple these days by means of hysteroscopic surgery, essentially a one-day hospital stay, walk-in, and after one-day walk-out procedure by hysteroscopic myomectomy. On the other hand, a fibroid growing in the uterine wall, a myometrial fibroid, depending on the size number, may be asymptomatic, but sometimes it too can give rise to heavy menstrual bleeding, intermenstrual bleeding, or painful periods. If you have a pregnancy, these big fibroids, if they are big in size, may come in the way of successful outcome of reproduction in the form of right from the time of causing infertility, if they are at the cornual end blocking the tubes, or if they are growing into the uterine cavity. They can also cause pain, and they can also cause early pregnancy losses or late pregnancy losses or preterm labor. A fibroid in pregnancy can undergo certain changes which we call red degeneration, which can give pain and discomfort to a woman, but through medical interventions we can tide over this kind of a symptom and crisis. The third kind of a fibroid is which grows right outside the uterus. If it is small, it is completely harmless because it doesn't cause pain, discomfort, but as the size keeps increasing and increasing, just by the mere size it can cause pelvic discomfort because of pressure and thus start pressing on important organs around it in the pelvis, ureter being a very important organ. So if a fibroid grows outside and causes a pressure on the ureter, which is a pipe leading urine from the kidney to the bladder, then this ureter gets compressed and causes a back pressure on the kidney, which on ultrasound can be seen to have hydronephrosis. So when do we really care about fibroids and when do we really need to operate on them is when they are symptomatic. Symptoms in the form of abnormal bleeding, heavy menstrual blood loss, pain, discomfort, pressure symptoms, and poor reproductive outcomes. Thank you.